So the next question is on aseptic opening techniques. And the question is, how often are these techniques reviewed and updated over time? And what would require changes in that process?
So I think the opening and aseptic presentation techniques, I think for the most part, it's not something that gets reviewed. You're taught it as a surgical tech. And, since I'm a surgical tech, I'm speaking in that aspect from that point of view. You're taught as a surgical tech, as a circulating nurse, from what I do know or the nurse in the operating room, when you come on board and you learn the OR side of nursing, you're taught in the beginning. But unfortunately, it's not something that's reviewed on a yearly basis. It's not, let's say, a competency that we go and make sure that you have aseptic presentation. It's one of those things that you're taught, and it's just understood that you need to follow it going forward.
Okay. So it really doesn't change that often, or no radical. So if you started in 1950, theoretically the practices being used today are the same.
Exactly. And so now, being more involved in the packaging community and stuff, now I'm like going, maybe that's something we need to change, because, I'm like, you do, like you said, if you started back in the 1950s, whoever taught you is how you learned, right? Yep. And then even if you're a surgical tech and you went to school, whoever taught you is how you learned. And so even if you did learn correctly, we know over time those practices tend to get lapsed, right? If you're just you're continuously doing, okay, well, hey, I can open it this way and drop it, or versus, the right way. So, things happen. People's habits come into play. And the way people learn is a big factor. So just like I said, now it's like one of those things that I'm going, okay, maybe we need to review that, and
kind of looking at things
and
questioning.
Some kind of competency on that, but
yeah. So Malinda talked about the IFUs and the information on it. Is it informative to the people opening the packaging? Is it used in training? How are IFUs, instructions for use, used in the OR?
So for us, IFUs are extremely important. I know, I will say in my past experience, they weren't as important. I feel like now we're really gaining a lot of ground on making sure the IFU is met, it's read, it's known. So it may not be so much the person necessarily who is opening is, pulling out a paper and reading an IFU right then and there. The importance the IFU has and plays is when we're writing our procedures, right?
Oh,
and
sure.
So if I'm writing a procedure on how to open a package, I'm going to follow the IFU to make sure I'm writing those procedures accordingly, or the standards, right? And so those are my guidelines for writing that procedure or that policy. And the person who's opening it is going to follow that procedure and policy. So in an essence, that IFU plays a big role in what they do. I don't know if they know necessarily that it does, because unfortunately, like I said, it's just really starting to gain traction and ground. And you might be able to go to the OR and find maybe 10 people who know what an IFU stands for or what it is.
Sure.
But as you start talking to them, they'll be like, oh, yeah, the manufacturer, what they say to do. And we're like, yes, that's your IFU. So I think it does play a big role, but it's just not in the essence that maybe a packaging person might think of, more so in a practical sense.
So this wasn't part of the question, but to dig a little bit deeper into that, you talk about how those instructions get put into your procedures. And I don't even necessarily know that a lot of manufacturers have opening techniques detailed in IFUs. But if they do, how do you manage conflicting ones between different products?
Yeah. And so it's the overall, right? Like, so let's just say we have 4 different manufacturers and 2 of them say one thing and 2 of them say another thing. We go with the most case scenario. Like, for instance, if they both say, you know, you want to open it and hold it at this angle, and the other ones are just saying open it, you know, like we make sure that we use this angle, right? So because that's the best case, and so we just make that best case for all. Now, if they're two completely different ones, then you have to have two different policies and procedures for it.
Okay.
That's when it gets really complicated. And so, you know, dealing in a hospital in the OR where you have, you know, thousands of manufacturers, it can be very complicated. And, you know, and that's why I'm very adamant of having a more systematic IFU process and standard.
Absolutely. Yeah. I mean, I've heard that different hospital systems might have, I want to say, like upwards of 20,000 plus devices that may come in and out of its doors at any time. It's like, that just blows my mind.
Yeah.
But I mean, it makes sense because that's what they're all for, is to be used in a healthcare setting. So.
And you got to think too, like, you know, the OR people they have to know all those devices and all those processes for every one of them. And it's a lot.